041,000.
There we go. Okay, so as Nadia said, I'm Laurel. I'm a senior majoring in anthropology, but I was able to do my internship and research this summer through CSRI. And I just wanted to give some brief background. I did it with an organization called the Central American Resource Center, CARESCEN. And so I wanted to give some brief information on CARESCEN and then my initial reflections about my research that are still evolving as I move towards writing an honors thesis in anthropology this year. So CARESCEN is a multi-service organization in San Francisco that serves multiple demographics. So it serves low-income people, Latinos, and immigrants from all over the Bay Area. And I wish my community partner wasn't able to make it, so I'll just give a brief overview of what they do. Their main programs include an immigration legal program, youth, which was one of their earliest programs, youth case management, family advocacy through case management, and also parent workshops in schools. And then a health promotoras program that does workshops on nutrition, oral health, and other health-related topics in the community. And then in addition to those services, CARESCEN, since its founding, has been involved with local and national advocacy efforts on various different topics, immigrant rights, violence prevention, budget justice within San Francisco, just to name a few of the campaigns that they've worked on and advocacy efforts that they've worked on. And for me, working there as an intern was a great experience, and I felt like both the research aspects and the internship complemented each other, and let me learn different things and think about my experience in different ways. So through the internship, I was able to be involved with the day-to-day work of the organization and compensate them some for the time that they invested in me. And then thinking about taking field notes every day and doing interviews let me put my experience in more analytical terms, and it's something that's going to let me continue that research and that learning and thinking later on. So through the internship, I did a couple main things. I helped design a youth leadership program for high school age youth that just launched this year. It's going to be a year-long program. And I specifically helped design evaluation tools so that because they're doing all this great work, but they often don't have the capacity to evaluate what they're doing to show that it's effective. So I helped design qualitative and quantitative tools that'll then let them show that what they're doing is effective and reflect on it internally. I also happened to be there during the re-registration period for temporary protected status, which is a temporary asylum status for people from multiple countries, but I was there during the period for Salvadorans. So I worked with the legal services program, helping people renew their paperwork. I also provided childcare during weekly parent wellness workshops, which let me get to know a group of parents that I later interviewed. And a large part of what I did there was just being present and listening at meetings and events, and just day-to-day life in the office. And that, I think, really gave me a broader understanding of what they do. In terms of my research, as I said, I did interviews. I ended up interviewing about 20 people, mostly staff members, but then some of the mothers from the weekly wellness group. And I also took field notes every day on what I was seeing and observing. And I don't have so as I said, this is a year-long process for me, so I don't have concrete findings yet, but one of the aspects that I thought about a lot this summer and that I want to focus on in my research is how CARESCEN interacts with local government through both policy advocacy and teaching clients to be self-advocates within kind of the government bureaucracy of social services. So first, I'm interested, one of the things that came through really clearly was the ways that in interviews and observing was the ways that CARESCEN uses its expertise as a service provider to gain voice and political legitimacy within the political system. So a lot of staff members talked to me about the ways that working with people on a day-to-day basis gave them and the organization a field of specialized knowledge and expertise that they were able to use that expertise to to gain legitimacy when they talk to policymakers. So having stories, having data, being able to represent, they work with a wide variety of people, so at-risk, that people that might not come into contact with each other normally. So for example, at-risk youth, immigrants, people from Latin America, and immigrants from Latin America, and globally, more established immigrants like the people I worked with through TPS who have been here for 10 or 20 years. So working with a range, with a diversity of clients, and working with them on a daily basis gave them that specialized knowledge. And it was important that they not only had those experiences, but were able to demonstrate them through stories and data when they talk to city officials. And also, they work really hard to maintain good working relationships with city officials so that they can bring those voices forward. And then the second thing was that at the same time that they're advocating for people within the political system, they're also do a lot to teach their clients how to be self-advocates. This was, especially with the parent leadership workshops and parent wellness workshops, a lot of them are focused on how, teaching people how to talk to their child's teacher, how to talk to school administrators to know their rights if they get stopped by the police, and to not just accept things passively, but be forceful advocates for themselves. The case management program for parents also did a lot of this, and did a lot of teaching people how to navigate the social service system. So it was and when I talked to case managers, it wasn't framed as we're helping clients, it was we're teaching them to be their own advocates. And I think together these methods allow Crescent to meet the needs of their clients in different ways. I very much think that and they saw it this way, that teaching clients to advocate for themselves is a powerful form of resistance when especially undocumented immigrants don't have a lot of formal power. And then advocating their advocacy for clients' needs gave them authority where so they had authority in the political system that individuals, and especially undocumented individuals, might not always have. And then so the next steps in my research are looking at secondary sources on what other people have written about these dynamics in San Francisco, doing follow-up interviews with people at the organization and hopefully people in local government, and then sharing my research throughout the process to get feedback on whether what I'm writing is actually matches up to what people told me and what their experiences are. And so in closing, I wanted to thank the people who made this experience possible. First, the CRSI program, especially Nadia and Jesse, who helped me prepare for the summer. And then my advisors in anthropology, Kathy Cole and Lisa Mulkey. And lastly, everyone at Crescent for being completely welcoming and honest and patient with me. And I know that taking on an intern was an investment for them. And I hope that I was able to contribute some back with my internship, and also that I think my goals for my research are that it's first an accurate portrayal of what I saw and what they told me, and that while it may not be directly useful for them, that it's a thoughtful engagement with what I saw, and also hopefully will contribute to the organization's reflection and let them share their work and think about their work in different ways. So thank you all for listening. Are there questions?
I was interested in the point where you discussed being able to use some of the data and stories for when they talk to policymakers at the city level and things like that. And I was curious if there are any types of stories that were particularly engaging or outcomes that the policymakers were looking for, and how your data might have helped them get examples to use.
Mm-hmm. Well, so the evaluation tools that I worked on for the youth program they're being implemented this year, but they were, I think, when they talk to city officials and private foundations, people told me that those groups are interested in quantitative data.
Okay.
So
So being able to have kind of survey measures and that
Mhm.
kind of thing, they want to see that type of response.
yeah, so one of the survey instruments is a self-esteem and resiliency survey. And then I also, another thing that came up a lot was their work with at-risk youth. So they work with gang-involved and formerly gang-involved youth, which is a fairly unique program within the city. And that gave them, several people mentioned that when that was useful when they were talking to policymakers.
So looking at that group of people.
Mm-hmm.
I think when I read your paper, I was thinking a lot about this dynamic in the nonprofit world, where I think that in the past, the consensus was you gotta do service or you gotta do advocacy or policy. You can't do them both well at the same time. Versus it seems like now the nonprofit world is moving towards actually they're very complementary and you're better at each of them when you're doing them both. What was your experience with, where is Queresen in that continuum and what do you think about that?
Mm-hmm. I think that's fair. I think it's a trend within the nonprofit sector to be moving towards both doing services and advocacy. I think Queresen has very much been involved in both. One of the difficult things though is that it's a lot harder to get funding for the policy advocacy. And there are a set of restrictions because they're a 501c3. So that was something they struggled with, and I saw the kind of teaching people to be self-advocates as one response to that. Yeah.
In your paper, I was so interested by your discussion about how kind of politics itself was defined by people in Queresen, and I think that ties to the sometimes tension between service and political advocacy. So I was wondering if you could just touch on that, because that was such an intriguing part of your research.
Yeah, so a lot of times they aren't able to frame the services they provide in a political context. So they're receiving money from the city and teaching people to be self-advocates, but it's not. There was a focus on meeting people's empirical needs and providing services that met the needs of a wide group of people. So like immigrants from all over the world, low-income people in San Francisco in general. But that was that was translated differently when they did policy advocacy. So they often, I think I might have talked about this less in my paper, but when they do policy stuff, they sometimes have to frame their work in terms of a Latino constituency. And then I want to think about how, the voice that it gives them, but also how that voice is privileged over others. So how groups that do just community organizing or just advocacy or individuals might not have as much legitimacy within the political system. Yeah.
Are there any other questions? No?
Okay,
Well,
thank you.